Did you know your chances of a heart attack increase significantly after 65? This isn't fear-mongering, it's a proven fact. But here's what most people miss. Aging itself doesn't cause heart attacks. It's what you do, or neglect, after 65 that truly matters. Many older adults don't realize how daily habits quietly impact their heart health. The good news: you can take control starting today. In this video, we'll reveal the top 10 powerful habits that can safeguard your heart and even extend your life. These aren't complex or costly. In fact, most can be done at home without medication. But number 1 is the most underrated, and it could save your life. If you're over 60 or care about someone who is, this might be the most important video you watch this year. Before we dive in, hit like and subscribe. We share life-saving tips weekly, tailored for seniors. Let's begin the countdown to a stronger, healthier heart. 10. Stay hydrated daily. Dehydration might not seem linked to heart health, but it is. When you don't drink enough, your blood thickens, straining your heart and raising clot risks. Many seniors drink less to avoid frequent bathroom trips, but this habit is risky. Your heart needs proper hydration to pump blood efficiently. Thick blood can lead to plaque buildup and high blood pressure, key triggers for heart attacks. Aim for 6 to 8 glasses daily, more if you sweat or live in heat. Don't wait for thirst. Make it routine. Start mornings with warm water. Sip throughout the day, or try herbal teas or lemon-infused water. Hydration also supports kidneys, brain function, and joints. Dark yellow urine. Drink up 9. Avoid smoking and secondhand smoke. Even occasional smoking or secondhand exposure can be deadly after 65. Smoking hardens arteries, spikes blood pressure, and forces your heart to overwork. Here's the truth. Some damage from past smoking lingers, but quitting now still helps. Within weeks, blood pressure improves. Within months, circulation rebounds. Over time, heart disease risk drops sharply. If you don't smoke but are around those who do, set smoke-free zones at home and in your car. Quitting is the best gift for your heart, lungs, and longevity. Move for 30 minutes daily. Your heart is a muscle. Use it or lose it. Regular activity is a top defense against heart disease. You don't need intense workouts. Walking, swimming, yoga, or dancing for 30 minutes daily lowers blood pressure, cholesterol, and clot risks. Avoid long sitting sessions. Stand hourly, stretch, or do seated exercises if mobility is limited. Consistency beats intensity. Start slow, but start today. Cut salt and processed foods. Excess sodium is a silent threat. It causes water retention, raising blood volume and pressure, a recipe for heart strain. After 65, kidneys struggle to flush sodium, worsening the impact. Hidden salt lurks in canned soups, sauces, bread, and snacks. Keep intake under 1,500 mg a day, met 2-3 TSP. Choose low-sodium options, flavor meals with herbs, and prioritize fresh home-cooked foods. Your taste buds adapt in weeks. Your heart benefits for life. Schedule regular heart checkups. Feeling healthy doesn't always mean your heart is. Once you pass 65, routine medical screenings become essential. Many older adults unknowingly live with elevated blood pressure, high cholesterol, or undetected heart damage, often realizing it only when serious problems arise. Doctors can identify early red flags long before noticeable symptoms develop. Make it a habit to monitor your blood pressure every few months, particularly if you're on prescribed medications. Annual blood tests to track cholesterol, triglycerides, and glucose levels are equally important. For those at increased risk, additional tests like electrocardiograms or stress tests can uncover artery blockages or irregular heart rhythms before they escalate into emergencies. Skipping appointments because you feel fine is a dangerous gamble. Preventive care is far simpler than treating a full-blown crisis. These routine evaluations help shape smarter decisions about diet, activity, and treatments. A few minutes spent on tests today could spare you from life-threatening complications tomorrow. Staying vigilant with screenings is one of the simplest ways to safeguard your heart's future. Make stress reduction a priority. Chronic stress does more than weigh on your mind. It actively harms your heart. Prolonged tension drives up cortisol and adrenaline, which constrict blood vessels, elevate blood pressure, and force your heart to work harder. Older adults frequently face hidden stressors like isolation, financial strain, or health anxieties that compound over time. Left unchecked, this can spark inflammation, disrupt sleep, encourage unhealthy eating, and even trigger abnormal heart rhythms. The solution lies in daily relaxation practices, something as simple as focused breathing exercises, meditative moments, with a warm drink or brief sessions of gentle stretching can make a measurable difference. Spending time outdoors, confiding in a trusted friend, or listening to calming music also helps diffuse tension. Be mindful of evening routines. Avoid stressful media or heated discussions before bedtime. Suppressing worries only magnifies their toll. Recognize that mental peace and heart health are deeply intertwined. By adopting small but consistent stress relief habits, you're not just soothing your mind, but actively strengthening your cardiovascular resilience. Maintain healthy blood sugar levels. Elevated glucose levels pose a serious threat to heart health, even for those without diabetes. Excess sugar in the bloodstream gradually erodes the delicate lining of arteries, creating ideal conditions for plaque accumulation. This narrows and stiffens blood vessels, dramatically increasing risks of heart attacks and strokes. Seniors are especially vulnerable due to age-related metabolic changes. Warning signs like persistent fatigue, unusual thirst, or blurred vision should prompt immediate attention. Diet plays a pivotal role in glucose management. Reduce consumption of refined carbohydrates and sugary foods, opting instead for fiber-rich vegetables, whole grains, and low glycemic fruits. Balanced meals incorporating lean proteins and healthy fats help stabilize blood sugar fluctuations. Light physical activity after eating, such as a short walk, enhances the body's ability to process glucose efficiently. For individuals prescribed diabetes medications, strict adherence to dosage instructions is critical. Never adjust treatment without medical supervision. Keeping blood sugar within optimal ranges does more than prevent diabetic complications. It serves as a powerful defense against cardiovascular deterioration. Manage cholesterol proactively. Cholesterol imbalance quietly contributes to heart disease by depositing fatty plaques in arterial walls. These deposits gradually restrict blood flow, potentially leading to complete blockages. The insidious nature of high cholesterol means many seniors remain unaware of the danger until significant damage occurs. Aging bodies process lipids less effectively, making even moderate dietary indulgences riskier. Annual cholesterol panels are non-negotiable after 65. Ideal targets include LDL, bad cholesterol, below 100 mg/dl and HDL, good cholesterol, above 60 mg/dl. Dietary adjustments can yield substantial improvements. Replace fried foods and fatty meats with omega-3 rich fish, nuts, olive oil, and soluble fiber sources like oats and flax seeds. When lifestyle changes prove insufficient, prescribed lipid-lowering medications provide an additional protective layer. View cholesterol management as routine maintenance for your circulatory system. Consistent care prevents catastrophic breakdowns. Monitor blood pressure diligently. High blood pressure operates as a silent saboteur, inflicting gradual damage to your heart, arteries, kidneys, and brain without obvious warning signs. After age 65, blood vessels naturally lose elasticity, making hypertension both more likely and more dangerous. Consistently elevated readings above 130/80 mmHg significantly elevate your risk of heart attacks and strokes. Invest in a reliable home blood pressure monitor and establish a regular checking routine. Weekly tracking provides valuable trends rather than isolated snapshots. Fluctuations are normal, but persistently high numbers warrant medical consultation. Beyond medication, if prescribed, Lifestyle interventions prove powerful. Reduce sodium intake, maintain a healthy weight, engage in moderate activity, and limit alcohol and caffeine. Stress management techniques like paced breathing can lower readings during tense moments. Remember, hypertension doesn't cause pain until it triggers a crisis, making proactive monitoring your first line of defense. Cultivate daily consistency. The ultimate safeguard against heart disease isn't a single, grand gesture, but the accumulation of small daily choices. Heart attacks develop through years of neglected warnings, but the same principle works in reverse. Consistent healthy habits compound into powerful protection. This means honoring your body's needs even when inconvenient, preparing heart-smart meals despite fatigue, taking that evening walk when you'd rather relax, or refusing that extra salty snack. It requires planning, scheduling checkups in advance, setting hydration reminders, or prepping healthy snacks for busy days. Most importantly, it demands self-compassion. Occasional indulgences won't undo progress if followed by quick returns to good habits. Aging inevitably changes your cardiovascular system, but decline isn't inevitable. By treating heart health as a daily practice rather than an occasional concern, you build resilience that medications alone can't provide. Your future vitality depends less on luck than on the hundreds of seemingly minor decisions you make this month, this week, today. Heart disease develops stealthily, but so does heart protection. The 10 strategies outlined here, from hydration to screenings to stress management, work synergistically. No single habit carries the entire burden. Together, they form an impenetrable shield. Implementation matters more than perfection. Begin with 1 or 2 manageable changes, then gradually incorporate others. Track progress through how you feel. Better energy, improved sleep, steadier moods often precede measurable medical improvements. Remember, your heart's health isn't just about adding years to your life, but life to your years. The effort invested today pays dividends in preserved independence, mental clarity, and the ability to savor meaningful moments. Share this knowledge with loved ones. Heart health is a team sport. Your strongest heartbeat might be the one that inspires others to take action too. The clock is always ticking, but the power to influence its rhythm remains in your hands. Start this moment. Your heart is counting on you.